we're doing is we're actually taking the whole skin tunnel, front, back, and the tunnel, and it's being removed in one block. So this is almost like a dumbbell. I'm Dr. Dhir, a facial plastic surgeon in Beverly Hills. I want to show you my patients are real people who want natural results.
I'm Laura and I work in the fashion industry in an e-commerce company. I'm here because I need to get my ear fixed. I started wearing really heavy earrings a long time ago and it started just pulling, and it's gotten to the point where it's almost totally ripped through my ear, so I need to get it fixed in order to start wearing earrings again. I came to Dr. Dhir because he's one of the best in Beverly Hills. So I saw him on Instagram and I saw what he was doing with another patient with their earlobe and kind of contacted him for that. I'm a little bit nervous just because I don't like needles, and so I'm a little afraid because I've heard that they have to cut all the way through your ear and it kind of freaks me out, but I think by the end of it, I'll be so happy when I get it re-pierced and I can actually wear earrings again.
Hello, Laura. How are
Hi,
you?
good. How are you?
Welcome to the practice.
Thank you. Nice to meet you.
It's so great to meet you. So what are we talking about today?
We're talking about my ear. So I ended up a couple years ago wearing really heavy earrings and it ended up ripping almost all the way through. So I need to get it fixed.
Okay.
Yeah.
Is it stopping you from wearing earrings right now?
Yes. So I haven't worn them in like probably a year and a half. Okay. So I definitely need to wear them again.
when you wear an earring, what happens? Does it like pull on the lobe?
Yeah.
Does it look right, or how
it
is
pulls
it?
almost all the way through, and I'm afraid that at some point it'll rip all the way through, and so it just looks gross. It looks ugly, and I would like it fixed.
Understood. 100% understand.
Great.
I want to get you back to wearing earrings.
Yes,
okay?
please.
I want to
Thank
enjoy
you.
that. I would love to see you wearing your new earrings.
Great.
Okay. So to get there, I want to talk about what the process is. And the only way to kind of offer you the options is to understand what is an earring piercing and why we have to do what we have to do. We understand that a lot of people go to a mall, they go to a piercing parlor, and you know that there's a gun, right? And they put the piercing with a stud, and that stud goes through the earlobe.
Right.
The earlobe is made up of skin and skin on the back. And in between, there's a small layer of kind of fat just to protect the earlobe. It's a cushion layer, and that's just skin and skin. So what happens is as we pierce the ear, you remember you're supposed to wear that piercing, that stud piercing, for approximately 3 weeks or whatever they say before you change it. And the reason is when you go through the skin and the fat layer, that soft tissue layer, and then the back, you need to leave that stud in place, because what happens is the outside of the skin needs to crawl through that tunnel and meet the back of the skin. So you're left with a tunnel of skin. So today what I'm gonna do is I'm gonna actually make a new piercing in your ear surgically. So here's our earring piercing hole that's actually elongated. If you haven't put a heavy earring in here, you'll see that it elongates and you actually see through the ear sometimes. That's sometimes unsightly for patients. And so if you look very closely, the skin, the earlobe, the piercing, to get that done correctly, you actually have the front skin, and you also have the back skin of an earlobe. And if you can see how it puckers in, and it's hard to see, but I want to get the idea of what happens is the skin from the outside connects to the skin on the outside, as you can see here, and it's a tunnel of just skin. So you can't just close this to this and close the back skin together, because then you'll have that trapped skin that's going through the tunnel. So what we need to do is we have to remove that tunnel, front and back, and then I'm able to close it with small plastic surgery sutures, and this will heal with a small scar in the same kind of line as her original piercing, but it'll be a small line here, and this will go away in time. And then, at 3 months approximately, we can hopefully get you re-pierced, and I want you coming in here with your new earrings.
Sounds good.
No matter how big or small the procedure is, my patient's comfort is my #1 priority. For this specific procedure, I use Novocaine to completely numb the area so my patients feel zero pain. All right, so you're comfy?
I am.
Your leg's okay up high?
Yep, just warn me before you stick me with the
definitely
needle.
I will warn you about everything we do. I'm just kind of setting up. First, we're gonna get a little cool alcohol pad, and I'm gonna go around your ears to get you sterile.
Okay.
Right now, I'm going to mark your piercing, so I know exactly what I want to take out, and we can get a great result. All right, let's have some fun. Okay, what you're gonna feel right now is a quick poke, and then you're gonna feel there. That's it. But now you're gonna feel a little bit of a burn. That's not me. That's the medicine, and that's completely normal. You're gonna feel a little bit of a burning sensation, and then it'll turn into tingling, and then it'll turn into complete numbness. Okay.
Okay.
And you're doing a great job. That was the worst of it.
Perfect.
Okay. I'm already injecting. You feel that burn?
Yep.
Okay. You can tolerate that, correct?
Yes, not bad.
I'm doing a little secret way of injecting, so I'm pinching you here, and then you won't feel where I'm injecting. Great job. And we're done. I'm I'm gonna do now is you're gonna feel something cold. You'll feel pressure,
Yep.
you feel cold, but you should not feel any pain. This is a surgical procedure, and therefore I perform a surgical protocol, which is to keep it completely sterile. Even though we're doing an exam room, we are gonna treat it just like any kind of surgery. I'm not gonna get started until you get completely comfortable. I want to do a little couple test areas. Okay, do you feel that?
Nope.
Good. And the last one, do you feel this?
Nope.
Good. All right, you are completely numb. Let's get started. What you do is you just make a small incision around that line. What this is completing the new piercing. You're doing amazing. So what we do now is that we're going to trim the skin that goes through the tunnel and make a fresh tunnel. So I'm going to start to remove that skin after I made my initial incision around the original piercing. You're almost done. You're doing really well. After we've removed the skin, is that this will actually show exactly what we're doing. Number one is the skin is now fresh. These will actually heal together now. If you look in the inside of the earlobe, this is that cushion layer or that fat layer you can see here. That skin now is gone. This is actually fresh cushion layer, which actually will heal to the other side. Back of the ear, same thing. This skin is now fresh, it will heal. And the middle layer, again, that cushion or fat layer will also heal, and now we'll have a fully healed earlobe. All right, so now we're gonna close this. In general, we wanna close this in layers. You wanna have the middle layer to close, the front, the back. However, I feel like in the earlobe, I don't want extra scar tissue, so I try not to leave a deep layer. I try to just get deeper closure with my insides and outs, the front and the back. So we're just gonna put 2 or 3 on each side and get a little deep so we can get the layers to come together. So we're gonna do the back. So we're doing the exact same closure, getting some deep cushion layer. We're gonna put the skin together just like we did for the front, and this will be our back closure. All right, so we are officially done. We have our suture line in the front and our suture line in the back, and this will heal really well with just a straight mini fading scar over time. Tomorrow you might have a little bit of tenderness, a little soreness. This should all be okay with Tylenol or the pain control. After about a day or two, you shouldn't even forget about it. I'm gonna see you on Friday. I'm gonna take out the stitches, and you'll be able to see your new scar. You will see that it's just like any other scar. It's there. It's going to go through a little red phase. It's going to drop. It's going to go through a little bit of a white phase, so you will see it. And then eventually your pigment of your skin comes back in, and then it kind of fades away.
Great.
All right, so that's understood. Any
Yes.
questions at all?
No?
All right, I'm going to finish up by putting on a little bit of a dressing. So I do want to keep this dry during bathing and showering.
Okay.
Put your back to the shower, let your hair get wet, but then try not to get anything wet on here. Use a towel on your face, okay? Welcome back. I hear we had a little adventure of re-piercing, so I can't wait
Yes.
to hear all about it.
Yeah, it turned out great.
It looks good. You've actually healed all the way through. Good. This is the small scar that we see that's healed nicely, both sides. The earring hole that you have that you re-pierced actually looks like they put it in a great spot, not right through the scar, which is really nice. And that looks like it's very tight. You'll be able to wear an earring. About 3 months, 4 months.
Yes.
I let patients go ahead and get it re-pierced, and you went through it. So did it hurt?
Nope, did not hurt. Went with a friend of mine and we had a piercing party and it turned out great.
And I hear we're getting married.
Yes, so that's great.
So we're gonna pick the special ones for the
Yes,
special
I'm
day?
in the process of finding something.
Oh, I'm so excited for you.
Thank you, I really appreciate it. It turned out great, I absolutely love it. Dr. Dhir was awesome, it was painless, he was great, very professional, and couldn't ask for a better doctor.
Lauren's ear piercing looks great. I'm really happy for her because now she can wear the earrings that she wants with confidence at her wedding. I'm excited to see her photographs, and I'm excited that you got to see the experience. Thanks for watching this episode of Plastic. Please follow me on social media, subscribe, and watch this next video. We'll see you soon.